Good morning, Abigail. My name is Sharon. I'm going to be your nurse today. Can you tell me what brought you into the emergency department?
Um, it's my leg. I'm having pain in my leg. I'm a sickle cell patient,
Okay.
and I'm having a sickle cell crisis. I've tried all my medication at home, but the pain is still really bad.
Okay. Well, I'm sorry to hear that. On a scale from 0 to 10, 10 being the worst, can you rate your pain right now?
It's a 10.
It's a 10. Okay. And is that an acceptable pain level for you, or what's your baseline?
No, it's not acceptable. My baseline is usually a 4.
Okay. And is this episode, this pain crisis, similar to ones that you've had in the past?
Yes, I came in last month with leg pain just like this, and I was admitted to the hospital for about 5 days and treated.
Okay. Do you have pain anywhere else, like your chest or your abdomen?
No, it's just my leg.
Okay. And what worked for you last time when you came in with this much pain?
I had to be admitted in the hospital, like I said, and they had to give me a big dose of morphine and had to get intravenously 10 milligrams.
Okay. And did you run out of your pain medications at home?
No, I still have medication.
Okay. And what did you take before you came in today to the emergency department for the severe pain?
I took 30 milligrams of my tablets I have at home of morphine.
Okay.
And then I took 600 of my Motrin.
Okay.
And also I have oxycodone. I take 5 milligrams of that as well.
And what other medications do you take at home for your sickle cell disease? Do you take hydroxyurea?
I have hydroxyurea at home. Yes, I do. And like I said, I have oxycodone I take, and I have Colace I take. I have
Zantac? Okay.
Zantac, and also I take Folace.
Okay.
I take folic acid.
Folic acid. Okay. Would it be okay if I go ahead and take your vital signs now?
Sure.
All right. I'm just going to feel your pulses and count your respirations. Then I'll take a blood pressure. Okay. Then I'm going to talk to your doctor, and I'll come back with some medications after I get these vital signs. All right. Hi, Dr. Smith. I was wondering if I could speak to you about Abigail in room 55.
Sure.
Okay, great. So Abigail is a 55-year-old female who's presenting to us complaints of severe lower extremity pain. She has sickle cell disease, the SS genotype, and this is her 4th ED visit this year for sickle cell pain. She's been hospitalized 3 times for pain, and her last episode was a month ago. Now her pain right now is 10 out of 10 in her lower extremities, but she's not having any chest pain or any abdominal pain associated with that. Her vital signs are pretty stable. Her heart rate's 93, her respiratory rate is 12, her blood pressure is 145/86. She denies fever, and her temperature is 36.9. Her oxygen saturation is 98%. Okay, so she's playing with her phone. She seems a little distracted. I think that helps her cope with the pain. I asked her what she tried at home for this, and she told me that she has taken 30 milligrams of morphine, PO, and 600 milligrams of ibuprofen,
Okay.
PO as well. She had that similar episode last month and tried everything as with this current episode, and so she went ahead and came on in. So she said what works for her when she comes into the ED is an IV dose of morphine, 10 milligrams.
Right.
I think that 10 milligrams is a pretty big dose IV. I'm not really comfortable with that, but I think we should start an IV and maybe give her 5 milligrams.
Thanks, Cher. I just pulled up her EMR and saw that she was here last month.
Okay.
And she came here with acute chest pain during that visit too. You said she has no fever, no chest pain, and no desaturation, right?
That's correct.
Okay. And I see here that she got 10 milligram, which dropped her pain from 10 on 10 to 4 out of 10.
Okay.
And she seems to have tolerated that well, so no respiratory depression. Since she says that 10 milligram MS works for her, let's give her that. Let's do that for her.
Okay. So I've never given a 10 milligram dose
Okay.
of morphine IV. How about we give her 2 milligrams of hydromorphone instead?
Well, 2 milligram of hydromorphone is approximately equal to 10 milligram of morphine, and since morphine worked for her last time, and she says that works for her, let's do that for her. I think staying with that will help.
Okay.
We also need to start a PCA as soon as possible, but meanwhile, you keep administering the 10 milligram morphine for her every 20 minutes until pain is back to her baseline. let's keep assessing pain and sedation before each dose as well. And if the pain is not back to baseline within 3 doses, keep me informed.
Okay.
Okay. We might need to escalate or we might need to increase the dose to get her pain back to baseline. If we use lower doses and that does not work, it will just take longer to take care of her pain.
Okay.
So let's go and I will walk in there and check on her a little later.
Okay. Great. Thank you.